Now, I'm sure there are some parents who are very reluctant to pursue the question of whether their child is asthmatic. I think, nobody likes being labeled as having a chronic condition. But if a child is diagnosed as having asthma, what are some of the common treatments that they might be prescribed?
Just to comment on that point, it's interesting how parents would like to believe that their child, they've done everything for their child so they can grow and be healthy. And parents look at their children with a long scope, meaning they are anticipating decisions to allow them to make their children as healthy, not just for the next year, but for the next 10 and 20 and 30 years. And so in that point, what we've found in the last 5 to 10 years of research, and again, multiple governing boards have concluded this as well, that if we don't recognize and treat asthma in young children, the likelihood of them having that condition and actually affecting their lungs not only 5 or 10 years down the road, but well into adulthood, is actually very significant. So it's important that this discussion starts early, that parents are brought on board, that early intervention takes place so that these patients have a full lifetime of good lung health. As far as treatments are concerned, the typical treatments for asthma are really based on what type of asthma a patient has. We generally break down asthma in pediatrics into 2 large categories. One is if they are an allergic asthmatic or a non-allergic asthmatic. There are many other subcategories of non-allergic asthmatics, which I won't get into. The allergic asthmatics are the most common form of pediatric asthma, numbering anywhere between 60 to 80% of patients being allergic with asthma. Treatment for them really should be targeted towards the diagnosis of what they're allergic to. If you find out what they're allergic to and remove those offending allergens or try to treat those components aggressively, many times their asthma will actually subside or completely go away. Those typical treatments involve drugs like antihistamines, nasal sprays. Those nasal sprays can incorporate the use of steroids, as well as inhalers for the lung that involve medications like steroids and other types of what they call beta agonists, or drugs that open up the airway for long periods of time.